So my name is Ash Vasireddy. I'm a full-time orthopaedic trauma surgeon here in London. I'm actually only one of two full-time orthopaedic trauma surgeons here in London. In addition to that, I'm an air ambulance consultant flying around in a helicopter around London and the regions. And I also have some academic roles at some medical schools here in London where I'm a lecturer, and I'm also a non-exec director in some medical related trusts. I've always enjoyed topics such as biology and science and always enjoyed looking after patients. And then I've kind of fortunately ended up in orthopaedic surgery where I've really enjoyed operating and looking after the critically injured patient. So I'm in a very privileged opportunity in that I get to practice a lot of different specialties in medicine, and I'm actually a consultant in two different and fairly divergent specialties. So in orthopaedic trauma surgery, I have the privilege of looking after injured patients who are at their most vulnerable, but actually really being able to help them at that critical time, work along many other great clinicians and other allied health professionals as well, and nurses, etc., and therapists. In terms of the air ambulance stuff, that's again a completely different kettle of fish, but it's pretty much the same patient group. It's the critically injured patient, except I meet them at the roadside with their paramedic and their air ambulance team together, and we treat the patient with their, in terms of doing their emergency medicine interventions at the scene, and then take them to the hospital, and then they get further treatment there on in. But you still have to kind of bring your A game with your team, and it's always a team approach, and you have to deliver really efficient and optimal patient care so you can treat your injured patient.